Well, it was really interesting because, as you mentioned during your segment, we heard Justice Kavanaugh really sort of appear to show his hand. You know, obviously we never know how the justices are going to rule, but he really seemed to say that he thought the health care law could be upheld, that he agreed that the individual mandate portion of the law could go, but that the rest could stay intact, which of course is very important in terms of maintaining health insurance coverage for millions of people.
So then what's the significance of this case and its continuation, especially with Trump's term coming to an end?
Well, the timing, of course, you know, is strange because it's a week after the election, and it was something that was held in limbo until after the election, and we won't even know the results until probably next year. The Biden administration will have a big task ahead. They won't be able to, if the law were to be struck down, which people think is a long shot anyway, but if it were to be struck down, they wouldn't be able to do anything unilaterally. They would need the help of Congress. As it appears right now, we don't know who will have control of the Senate because there are 2 seats facing a runoff in Georgia. And if Congress is going to do something, they're all going to need to get together. And it'll be easier for Democrats if they have control of all the different sides of government.
So even with so much obviously up in the air at the moment, what do we know about the Biden administration's strategy for restoring and potentially expanding ACA in the face of these challenges?
Well, they've had a few different proposals that really rely on making the ACA available and more affordable to more people. It's true that millions of people have been able to get health insurance at very little cost, but it's also true that without subsidies, which millions of middle-class Americans aren't able to get, health insurance is out of reach and is too expensive. So the Biden administration and House Democrats have proposed plans that would allow more people to get subsidies. They proposed plans for more low-income people in states that didn't expand Medicaid, which is a government program for the poor, to be able to get those programs. And they're also looking at other ideas like lowering drug prices and ending surprise medical bills. But again, all of that is very much in limbo without having full control of government.
So then, as we look at all these pieces then, what sort of pressure is the pandemic adding to the health system so far?
Well, it's adding quite a bit of pressure, mainly because a lot of people are losing their health insurance. I don't have precise numbers on that because it's hard to know because some people are getting furloughed instead of laid off, so they're able to maintain their health insurance coverage. The ACA can be a safety net for a lot of people. For example, through Medicaid, if you lose your job and you don't have an income for a while, then you're able to sign up for Medicaid essentially for free to be able to cover your medical bills. The Affordable Care Act health insurance exchanges are another option, but as I mentioned earlier, they can be expensive, and they also depend on people being able to predict what their income is going to be over the next year, and in the middle of a pandemic, when people don't know when they're getting back to work, that can be really hard to do.
I mean, especially since about 157 million Americans rely on employer-sponsored health insurance coverage. Now, even before the pandemic, the U.S. spent the most on health care per person in the world, even though health outcomes and the quality of care are not often ranked the highest. So what are the pandemic and other demographic shifts really highlighting about the sustainability of this current business model?
It does highlight the fact that we are a country that relies heavily on employer-sponsored health insurance. I think if both liberals and conservatives had their way, that wouldn't be the case. You know, conservatives would prefer that people sort of shop for their own health insurance and be able to keep that same health insurance regardless of whatever job they hold. And then liberals would prefer that everyone be enrolled in some sort of government plan. So there are a lot of holes in our system. It's very complex. There are many, many ways that people get health insurance: Medicare, Medicaid, the ACA exchanges, employer insurance. And so all of that complexity really does add a lot of holes in the system. And so all of that, it just, being in the middle of pandemic, it definitely lays all of that bare.
And so let's take a look now at Biden's COVID task force. Who are they and what can they actually achieve before, say, Inauguration Day versus beyond that point?
Well, that'll be tough to see if they can get all the information that they'll need from the Trump administration. We are hearing that they're not necessarily getting access to all the documents they need, that they might make it difficult for them to talk to career employees. The fact is the Trump administration has started quite a major effort, especially when it comes to the manufacturing and distribution of a coronavirus vaccine. And that handoff will have to go smoothly. And even once with, the Biden campaign and transition team has appointed, folks that are top experts in the field in public health and infectious diseases. However, they really are going to have an unprecedented task in front of them in terms of getting the vaccine out to millions of Americans and probably getting 2 shots of the vaccines out, given what we're seeing move ahead. So even with really smart people, there are probably going to be mistakes made, and that transition will have to go smoothly in order to really give them the right foot forward.
And as you mentioned, we did hear encouraging news about on the vaccine development front with the Pfizer-BioNTech late-stage trials. Where do things currently stand with the state of vaccine trials as well as the approval process?
Well, they're all in limbo, and even after they get them approved, they're going to have to manufacture massive amounts of vaccines, and they're also going to have to make decisions about who gets a vaccine first. Is it going to be the most vulnerable? Is it going to be healthcare workers? Is it going to be people who are young and about and who might otherwise transmit the virus to each other? So there's a lot of decisions that have to take place. It's not just about getting the vaccine approved, but then getting it to people and rolling it out smoothly. And Dr. Tony Fauci, who's the U.S. top infectious disease expert, said today that he thought that everyone could be able to have access by April, but it's a big question mark until we get a vaccine approved and until those rollout plans are in place and implemented.
All right. Thank you so much. Great having you on.